Good. Okay, can you just start by saying your name and your title?
Levi Taylor, physical therapist,
And where do you work?
St. Alexius Medical Center.
And what does being a physical therapist entail? What do you do?
I see patients that directly after they come out of surgery. I work on getting them in and out of bed. I teach them exercises, and I get them ready to go home safely.
Okay, and then how many hours do you normally work in a
About
work week?
about 40 a week.
And then describe like a typical work week or a typical day.
A typical day, we show up, we divvy up our patients depending on who's in the hospital. Then we just head down to the floors and start trying to see patients. So we see them, twice a day for each of the patients. That's about it.
So is it the same thing every day, or does every day bring a different challenge?
Every day is a little bit different just because you might be on the orthopedic floor where you're seeing the patients directly out of surgery, or you're seeing patients that, say, have pneumonia or cancer or different spots of the hospital.
Okay, and then how would you describe St. Alexius?
How I describe St. Alexis? In what way are you asking that?
Just like working here. Like, what's it like working here?
Oh, working here is great. I think it's a great team approach to treating all the patients. Everybody's really friendly. We all get along well together. We do a lot of different functions together, and so I think that's probably the best part about working here is that we like each other instead of just working together.
Okay, and then can you tell us a little bit about your schooling? Where did you go to school? How long?
Yeah, my undergraduate degree is from Colorado Mesa University, and I did that in exercise physiology. And then from there, I got into University of Mary, so I went to University of Mary for 3 years, graduate work.
Okay, and then so a total of 7 years?
Total of 7 years. There is a way where you could do it in 6 years, a pre-physical therapy degree, and then you go into your graduate work from there.
And then what were your favorite parts about getting your degree? Favorite classes?
Favorite classes, manual therapy was absolutely my favorite. I love hands-on. I like to work on people. It's pretty awesome when you can just go in and do a couple of different stretches, a couple of different moves, and the person feels better. So everybody likes to do that. The next one would be advanced orthopedics. What was the next class I would say I liked the most? Where we learned how to do all the tests to diagnose an injury, and then how we can specifically treat that sort of an injury.
And how did you decide on becoming a physical therapist?
Well, I really like the medical field, and being an actual medical doctor was not in my path. I didn't feel like that I was ready to take that step. But I really love exercise. I really love working on people, and I really love that person-to-person contact that you have for that length of time. And so that's why I chose physical therapy.
Approximately, like, when did you know that was your career path?
About 2 years into college, I took the long way around, and I went to I only took the minimum amount of classes in college until I figured out where I wanted to go, and then I loaded up on credits from there. So I'd say about 2 years into college is when I really decided.
And how did like school and coming to this decision like prepare you for that real life work?
Graduate, once you decide to go to graduate school, you're already just set on that plane. But undergrad, just a 4-year degree, they did a really good job preparing me just because they pushed you to look into further education. They didn't want you to just stop at just a bachelor's degree, and so they did a very good job getting me ready to go further into my career.
And what career goals do you have, or aspirations?
I personally would like to get into a more specific field. So right now I'm very broad into what I can treat and what I can go after, and eventually I have a goal of becoming a neuro specialist. So that's somebody that works with stroke patients or spinal cord injury patients. That's a goal of mine, to be a specialist in that.
And what do you think it takes to be successful in your career field?
I think you have to be very self-motivated because you constantly have to be educating yourself and doing continuing education courses. You have to be a great communicator, and I think you also have to be a leader. You have to be able to direct people and help people.
So I take it you like working with people?
I do like working with people.
Do you do any traveling?
The only traveling we do here is if we do a continuing education course. So that would be if I wanted to learn more about how to treat stroke patients, then I can go to a course and learn about it a little bit more. But they do often come to Bismarck, but it's a little more fun to travel and go somewhere.
And then what do you find are the most difficult parts of your job?
Difficult parts of the working in the hospital would be the really sick patients. And so it's really difficult to, somebody's sick and they're throwing up, and you try and go into a room and say, hey, let's get out of bed. They're not very happy with you when you try and do that. So I'd say that's the most difficult part.
And you mentioned teamwork earlier.
Yep.
Can you give another example of how you guys work as a team?
A great example would be when we're seeing a patient with a total knee replacement, and I would go in the room first, and I would see them, and I'd get them up to move and get them into a chair, and from there the occupational therapist can come in and work with them specifically on dressing activities or something like that. Another example would be if a patient's in a lot of pain in a certain position, a lot of times a nurse or somebody will ask for our assistance in adjusting them where they could be and positioning them so they're in less pain.
Okay, is there anything else you want to add about what a high